Hello, I am Husain Borki. I am second year medical student. What's your name?
My name is Murtuza.
And what's your age?
I am 23.
Okay. Today we are going to examine your nose, mouth and neck. So you are ready?
Yes.
So can we proceed?
Okay.
Now I will be doing your nose examination.
Inspect the anterior and inferior surfaces of the nose. Gentle pressure on the tip of the nose with your thumb usually widens the nostrils. Test for nasal obstruction by pressing on each ala nasi in turn and asking the patient to breathe in. Use a pen light or otoscope light to obtain a partial view of each nasal vestibule. If the nasal tip is tender, be gentle and manipulate the nose as little as possible. Inspect the inside of the nares with an otoscope and the largest available ear speculum. Place all nasal and ear specula outside your instrument case after use. Then discard or clean and disinfect them appropriately. Tilt the patient's head back a bit and insert the speculum gently into the vestibule of each nostril, avoiding contact with the sensitive nasal septum. Hold the otoscope handle to one side to avoid the patient's chin and improve your mobility. By directing the speculum posteriorly then upward in small steps, try to see the inferior and middle turbinates, the nasal septum and the narrow nasal passage between them. Some asymmetry of the two sides is normal. Inspect the nasal mucosa, the nasal septum and any abnormalities. Inspect the nasal mucosa that covers the septum and turbinates. Note its color and any swelling, bleeding or exudate. If exudate is present, note its character: clear, mucopurulent or purulent. The nasal mucosa is normally somewhat redder than the oral mucosa. Inspect the nasal septum. Note any deviation, inflammation or perforation of the septum. The lower anterior portion of the septum, where the patient's finger can reach, is a common source of epistaxis. Palpate for sinus tenderness. Press up on the frontal sinus from under the bony brows, avoiding pressure on the eyes. Then press up on the maxillary sinuses.
Now I am going to examine your lips. This will entail me to touch your lips, palpate it and look for any lumps or scars. Is it okay?
Yes.
Examine the lips by observing their color and moisture and note any lumps, ulcers, cracking or scaliness.
Open your mouth please.
Look into the patient's mouth and with a good light and the help of a tongue blade, inspect the oral mucosa for color, ulcers, white patches and nodules. Note the color of the gums, which are normally pink. Brown patches may be present, spatially but not exclusively in dark-skinned individuals. Inspect the gum margins and the interdental papilla for swelling or ulceration. Inspect the teeth. Are any of them missing, discolored, misshapen or abnormally positioned?
Open your mouth. Now I will touch your teeth to examine it. Is it okay?
Yeah.
To assess tooth jaw or facial pain, palpate the teeth for looseness and the gums with your gloved thumb and index finger.
Can you please open your mouth?
Inspect the color and architecture of the hard palate.
Okay. Now open your mouth and stick your tongue out.
Wearing gloves, palpate any lesions or lump on the tongue and inspect for
Stick your
any
tongue out.
asymmetry.
Okay. Open your mouth. Stick your tongue out.
With your gloved right hand, grasp the tip of the tongue with a square of gauze and gently pull it to the patient's left. Inspect the side of the tongue and then palpate it with your gloved left hand. Spatially, the side and the undersurface of the tongue and the floor of the mouth, areas where cancer often develops. Note any white or reddened areas, nodules or ulceration. Repeat the process to the other side.
Open your mouth.
With the patient's mouth open
Say
but the
ah.
tongue not protruded, ask the patient to
Open
say
your mouth
ah
wide.
or yawn.
Say
This
again,
action
ah.
helps you to see the posterior pharynx well. Alternatively, you can press a tongue
Open your mouth.
blade firmly down on the midpoint of the arched tongue, back far enough to visualize the pharynx but not so far that you cause gagging.
Okay.
Inspect the soft palate, anterior and posterior pillars, uvula, tonsils, and pharynx. Note their color and symmetry and look for exudate, swelling, ulceration, or tonsillar enlargement.
Now we will examine your neck. This will entail me to touching your neck and palpating it and looking for any lumps of lymph nodes. Is it okay? Does it sound okay? Yeah.
Inspect the neck, noting its symmetry and any masses or scars. Look for enlargement of the parotid or submandibular gland and note any visible lymph nodes. Palpate the lymph nodes using the pads of your index and middle fingers. Press gently, moving the skin over the underlying tissue in each area. The patient should be relaxed with the neck flexed slightly forward and if needed, turn slightly towards the side being examined. You can usually examine both sides at once, noting both the presence of lymph node as well as asymmetry. For the submental node, however, it is helpful to feel with one hand while bracing the top of the head with the other. Now fill in the sequence for the following nodes. First, preauricular node. Second, posterior auricular node. Third, occipital node. Fourth, tonsillar nodes. Fifth, submandibular node. Sixth, submental node. Seventh, superficial cervical node. Eighth, posterior cervical node. Ninth, deep cervical chain. And 10th, supraclavicular node. To orient yourself to the neck, identify the thyroid and cricoid cartilage and the trachea below them. Inspect the trachea for any deviation from its usual midline position. Then palpate for any deviation. Place your finger along one side of the trachea and note the space between it and the sternonucleidomastoid muscle. Compare it with the other side. The spaces between them should be symmetric. Auscultate breath sound over the trachea. This allows subtle counting of the respiratory rate and establishes a point of reference when assessing upper versus lower airway causes of shortness of breath. When assessing shortness of breath, always remember to listen over the trachea for stridor for upper airways etiologies in addition to examining the lungs. Inspect the neck for the thyroid gland. Tip the patient's head slightly back using tangential lightning directed towards from the tip of the patient's chin. Inspect the region below the cricoid cartilage to identify the counters of the gland. Ask the patient to sip some water and to extend the neck and swallow. Watch for upward movement of the thyroid gland, noting its counter and symmetry. The thyroid cartilage, the cricoid cartilage, and the thyroid gland all rise with swelling and then fall to the rest position. Locate the thyroid isthmus, usually overlying the second, third, and fourth tracheal ring. Now palpate the thyroid gland lobes. Ask the patient to flex the neck slightly forward. Place the finger of both hands on the patient's neck so that your index finger are just below the cricoid cartilage. Ask the patient to sip and swallow water. Feel for the thyroid isthmus rising up under your finger pad. It is often but not always palpable. Displace the trachea to the left with the fingers of the right hand. With the left hand fingers, palpate laterally for the left lobe of the thyroid in the space between the displaced trachea and the relaxed sternocleidomastoid. In the similar manner, examine the right lobe. Note the size, shape and consistency of the gland and identify any nodules or tenderness. In general, benign nodules tend to be more uniform ovoid structure and are not fixed to surrounding tissue. If the thyroid gland is enlarged, listen over the lateral lobes with a stethoscope to detect a bruit, a sound similar to a cardiac murmur but not of cardiac origin.
With this, we have completed your nose, mouth and neck examination. Thank you for cooperating.
Thank you.
After the examination, remember to record your findings.